Okay, I think we'll get started. Hello everybody, and welcome to today's UCL Global Business School for Health MSc Global Healthcare Management Leadership Route Taster Lecture. My name's Lauren. I'm part of the Marketing and Communications team for the UCL Global Business School for Health. Today's lecture will give you a taste of what to expect if you choose to study a Master's in Global Healthcare Management Leadership at Global Business School for Health, and help you gain insight into what it is really like to study on this program. The session's being recorded and will be shared via email following today's event. Now to introduce our speaker, I'm delighted to welcome Dr. Yemisi, Deputy Director of Education, Associate Professor in Organisational Behaviour and the Route Lead for the Global Healthcare Management Leadership Route, who will be giving today's lecture. Following that, there will be a Q&A session. So there's a Q&A button at the bottom of your Zoom screen. Please type in any questions you might have throughout the presentation, and we can answer them at the end of the session. And with that, I will hand over for the lecture. So over to you, Yemisi.
Thank you so much, Lauren, and welcome to everyone. It's such a pleasure to be here to speak to you this morning or this evening. It's morning where we are in the UK. I don't know what time it is where you are, but whatever the time, you are really welcome. I'm really delighted. And I'm going to be talking to you this morning about leadership. Okay, so let me share my screen so that you can have a look. I want us to see, be together on the same page. Hopefully everyone can see my screen. Can you type a yes in the chat if you're able to see my screen?
I can see it. It's just not on presentation mode at the moment.
Okay, so I'm trying to get that up. I think that's it. I think we're fine now.
Yeah, perfect.
Okay, so I'm going to talk to you about a topic. I've titled this lecture today, Understanding Leadership as an Imperative, something that is absolutely essential for resilience in global healthcare management systems. Leadership is one factor that is an imperative. This is UCL. UCL is known for producing world leaders. All right, this is our main campus. So it's a lovely, lovely place, historic buildings. As you know, the university is almost 200 years old, will be 200 next year. And it has, in that time, produced so many leaders across the world, so many prize winners, Nobel Prize winners. But today, I'm going to focus on you within the healthcare space as a leader. All right. So now you know a little bit about me. I would like to know a little bit about you. So if you could bring out your phones, right, point it at the screen, scan that QR code, it will take you to a Menti question, and I'd like you to answer that question. So let me, have you all scanned that? Let me take it back there. All right, for a moment. Hopefully everyone has got that. And now I'm going to go to Menti. So what's going to happen is that we're all going to see live as the results come through. Okay, so the first question should be, which part of the world are you from? So if you could just type India, Canada, Pakistan, China, Papua New Guinea, Indonesia. Excellent. I can see those names. Colombia. We've got someone from Colombia. A couple of people from India. Right. Where else are you from? China, Chengdu. Okay, is that a province? I really need to develop my knowledge of different parts of the world. There's someone local, someone from London, British from occupied Kashmir. Oh, okay. Interesting. You're starting to see, I'm sure you can see my screen. This gives you an idea of just how global the classroom is at the Global Business School for Health. We're still waiting for some people. I know there are quite a number of you here. Thank you for that thumbs up. But that's it. It's about the world. So when we're having this conversation, I want you to think globally as well. Okay? Thank you. Right, let me try the next question. Let's see. What is your educational background? So just type BSc nursing, MSc public health, whatever it is. Can you type it? That's the next question. What is your educational background? And I'll tell you the significance of that in a moment. What is your educational background? BSc, oh, spot on. Wow. Okay, here we have a medical doctor, BSc medical biosciences, MBBS. Okay, another medical doctor in here. You are exactly who we want in the Global Business School for Health. Oh, lots of doctors this morning or this afternoon. Great. This is a business school set up for you. Excellent. Business administration. Excellent. Population health sciences. That's actually the name of the faculty within which the Global Business School for Health sits. It's called Population Health Sciences. Excellent. Who else is there? Let me have a look. More of the doctors have responded. Do the doctors type really quickly? Okay, that's all right. Thank you. So a range of backgrounds in terms of the disciplines. Now, this is also important because within our classroom settings, especially the seminars, we give you cases to discuss. We pick cases from different parts of the world, so the curriculum is really diverse, and it allows you to see and engage with different issues across the world, from Africa to China to India to the West. You do Switzerland, you deal with all sorts of cases. And so, depending on what your background is, you're able to bring a different lens to view a problem, and you have a considered view. You look at it from different perspectives, and whatever recommendations you're making, they are really considered. That's the benefit. So when you come into the classroom, don't be afraid to voice your opinion. We actually need your perspective. Don't think, oh, I'm too different. I don't have a clinical background, or because I have a clinical background, I don't have a business background, I'm not sure how to approach this. No, we need your perspective. All right. Thank you, everyone. Now, let me check again, just one more. Do you have work experience? I know the doctors would have been working right through, but let's see. Do you have work experience? It's okay. Okay, good. I can see two in the public healthcare sector. That's all right. Two, not yet. That's fine. Again, that's the point I was making earlier. So if someone, it's a saying like a fish doesn't know it's inside water. Sometimes you're so close to an issue, you stop seeing some of the nuances or the edges there. But someone who's coming with a fresh pair of eyes, for instance, those who don't have work experience yet, can actually give you an authentic account of what that feels like, what that sort of policy would mean for someone who is a staff in a department. Okay, so it doesn't matter whether you have work experience or not, come into the classroom, and we will really have fun together, going, at those cases and really critiquing them, that critical evaluation. Thank you, everyone. No one here from the non-governmental sort of organization. That's fine. That's fine. Okay, so I'm going to go back to the PowerPoint, right, and move on from there. So as I said, I was going to talk about leadership as an imperative for resilience in healthcare systems. What do you think leadership is? Many times people use these phrases almost interchangeably. The leader is the manager, or the manager is leading. There are slight differences, and I'm going to share that with you. But before I do that, can you just scan the code again? Actually, it will be the next question. And I want you to answer that question. What do you understand by leadership? So what I want you to do is to type in there, I think leadership is this, while management is that. Okay? Leadership is this, while management is. So that's what I want you to do. Can you do that for me? And I'm going to go back to the mentee, and we'll see the answers together. Okay? What do you think is the difference between, just a quick answer, something intuitive, something that I know the doctors, you work, you do some management, but how would you describe leadership in your role? So a lot of you might be thinking about your background, and that's okay. So give the answer based on your experience or your background, and then we can unpack that later. What do you think is the difference between leadership and management? Leadership is this, while management is that, or I think management focuses on this, whereas leadership is about that. All right, I'm waiting to see the answers. Keep it brief. Keep it brief. I really would have loved to hear your voices, but we'll use the mentee. Thank you. The very first person has posted their response. Leadership is about inspiring and leading. Okay, you've used the word again there, as a role model. But management is taking control over your team and telling them what to do. Okay, there are some truths to that. Leadership certainly is about inspiring people and getting them to want to do something. right? That's what inspiration is about, getting them to want to do it. Being a role model, of course. And we will talk about this when I start to unpack the theoretical contributions. Management is about taking control. I agree with you that there's some element of control with management, but it's not in the negative sense. And it's not always about, yes, you do tell people what they need to do, but we've got to take sort of the negative edge off it, right? Let's look at a couple more. Thank you. A leader is a change manager, works on administrative tasks. Okay. Um, Whereas that answer is not complete. We're waiting for the manager bit. Because you've said a leader is a change manager. You've used the two words in there. Unpack that for us. Leadership guides people, shows direction, nudges the team. I love those words. About improvement. Okay, management could be about improvement too. Management is the structure, is the method to achieve the goals. Okay, that's really tactical. I like that. Shows direction, gives instructions. The leader also shows direction, by the way. The manager gives instructions. Yes, true. Leadership is influencing others, again, towards a common purpose. That's amazing. That's spot on. Management is about getting things done and achieving a work plan within a specific time frame. So, yes, these are correct. These are correct. Leadership is the ability to guide, to inspire. Inspire is coming again. People to do something towards the goal and change, whilst management is the ability to manage. Okay, you've used manage again, whoever gave that definition. I wanted you to, use other words. The ability to manage the organization and achieve efficiently. That's correct. Efficiently is the key word there. So with management, you're talking about efficiency, doing the most with the least amount of resources. And managing obviously includes, providing direction and control and all of that. Management is applied leadership. Oh, that's a complex one. Leadership is the quality needed for effective management. Well, yes, leadership is needed within management because the effects are different. Remember, we talked about inspiring people, applied leadership. I'm not sure what you mean by applied leadership, but let's see what my slides say. So I'm going to switch now. If you're still typing your responses, please do keep them there. I will see them and review them later on. But I'm going to go back to the slide now, and we'll see the definition. So, what is leadership? Because of this ambiguity in the two terms, it's useful to consider them sequentially. And this is how we do it. When you're talking about leaders, you're usually talking about a person who creates something new, right? A new organization, or someone who brings in stability to a chaotic situation. That's leadership. Transforming failing organizations. That is leadership. It's kind of talking or sort of hinting at a chaotic background, something that is ambiguous, something that is complex, and someone has to just emerge and make sense of it. That's when leaders emerge. Think about entrepreneurs. If you, as a medical doctor, wanted to start an entrepreneurship, endeavor like a business, medical technologies, so you are creating something out of nothing, out of nowhere. You have to bring in information from all over, make sense of it, and then start to say, right, I'm registering my company, I'm going to look for stakeholders, look for funders, and you start to put things together. It's leadership that does that. Whereas the manager focuses within a particular context, and one of you talked about that in your definition, focuses on deploying resources, assigning resources to tasks, efficiency, as I said, but within an existing hierarchy. So there's already something that somebody has created. There's an organization, there's a system. The manager keeps it going operationally. You see the difference? But the leader, this is why inspiration is very much a part of what leadership does, inspiring people towards the goal. And I'll show you a definition now. Just before that, so when people talk about leadership and management, managers kind of direct you. So it's very directive. That's your job description. Can you go and do that? And I will appraise you at the end of the period. And if you've sort of exceeded performance expectations, you get the reward, etc. That's management. So really pushing and directing you. Whereas the leader is more of applying people skills to influence positively. Let's do it. So it's a pull approach rather than a push. The leader is more, participatory in what's happening rather than go and do it, right? And Yokel gives us a wonderful definition of leadership. This will be our working definition today. It's about influencing others. Do you see? Some of you were echoing this. Influencing others to understand and agree on what needs to be done and how to do it. Do you see that chaotic sort of context at the beginning? Like, God, what do we need to do? You're talking to a team. Can we all come together? Can we be on the same page? Or why do we have to be on the same? Just getting people together to understand what needs to be done and how to do it. If they understand what needs to be done, but they disagree on how to get it done, there is no way you can get that team to achieve the goals as a leader. So what you're doing is really facilitating efforts, individual efforts, collective efforts, and just making sure all of that is being harnessed towards achieving those shared goals. That's leadership. You don't have to be at the top of the organizational chart. You don't have to be at the top of the organogram, of the hierarchy to be a leader. If you think in this more broad definition of leadership about influence, if you can influence positively for change wherever you are leading. If you're able to get people to understand and agree to what needs to be done and how to do it, you are leading. You may be in the middle management position, it doesn't matter. You are a leader. Do you see the difference? So leadership is not about the position, it's about the outcome. That's what I want you to focus on. Now, I want to talk about, let's contextualize what we've talked about leadership in what has happened in the world. So I'm going to give you 3 examples and we will see the implications for leadership there. We had the COVID-19 pandemic just a few years ago. And all of you are aware of this. I don't know where you were. Maybe some of you were in school or trying to get into school or working. It was a huge problem. And that event really exposed major gaps in global healthcare systems. If nations didn't care before about what was happening elsewhere, maybe it was only the WHO that was really concerned through its regional offices. Well, individual countries started to get interested in what was happening elsewhere. We started seeing gaps, failures in supply chains, overcrowding in hospitals, even vaccine distribution. How do we do it? How are we going to allocate the vaccines? In addition to the problems of people who were reluctant to even take up the vaccine. What were the key challenges for leadership? Managing rapid information flow during COVID and even misinformation. Governments were dealing with misinformation. And again, there was social media. So this was very easy just to send false information around. Allocating scarce resources. How do we allocate ICU beds, personal protective equipment? Those were hard decisions that had to be made. How do we allocate vaccines? Leadership during that period required leading collaborations across sectors. So between pharmaceutical companies and the primary healthcare providers, secondary, tertiary, global collaborations, maintaining staff morale. A lot of people were low on morale. Again, remember influencing, inspiring people. Their mental health was at risk. All of these things are happening at the same time. That's the challenge for leadership. Balancing public health with economic and social policies. What are we going to do? Where's the money coming from? How do we redeploy? All of this happening at the same time. So the lessons for leadership, how do you lead in times of crisis? Think about timely information, transparency in information, empathetic communication. So transparent communication, timely communication, empathetic communication as well. For instance, in the UK, I know we had daily briefings when the pandemic just started because we started to see the graphs and the charts figures. I don't know what happened in your country if you had daily briefings, but we had that here by trusted health officials because everyone was panicking. Leadership needed to learn how to adapt, even adjust policies in the light of new information. So, for example, we're starting to see the numbers, we're starting to see the incidence of cases with the testing results. And then government is adjusting policies and saying to people, okay, you can go out, but you have to line up, leave 2 meters in between you and the person in front, limited numbers of people indoors and all sorts, constantly adjusting that. Thinking in a systematic way or systems thinking, integrating public health, social care, and policy responses. And also thinking about equity, which groups are at risk of not getting enough access to vaccines or to medical care? Where are the vulnerable populations? Children, pregnant women, elderly people, people with underlying conditions. Imagine all of this happening at the same time. So this is where you really need much more than management. You need leadership with a vision, with the ability to synthesize all of that information. Let's look at the next example. This is Ebola. So this was in West Africa between 2014 and 2016. It was an outbreak and it was another crisis. This Ebola outbreak overwhelmed fragile health systems. It actually was very bad, killed about over 11,000 people. Initially, the response was slow, and which led to rapid concern, global concern, and the rapid spread of the virus. What were the challenges for leadership here? There was delayed international response. The local health context did not even have the capacity to deal with the problem. Then you had communities in West Africa, mistrusting authorities and health professionals. Remember, I talked about trusted health officials given transparent communication. It can really go downhill if that's not managed well. Then there was inadequate infection control, inadequate training for healthcare workers. There was a lot of stigma around patients who had Ebola. There was fear, even with those who are providing healthcare services to those who had Ebola. And some community practices even contributed to the spread. For example, when people are trying to bury their loved ones or the dead, the practice of touching them before the funeral procedure is over, that also contributed to the spread. But you see, you're battling local traditions. And you have to be able to deal with that in a way that you don't alienate those people because it will affect what the government, the healthcare system is trying to achieve. So, what are the lessons for leadership in this type of context? Cultural competency. You need to understand local customs and engage community leaders, trusted community leaders, which is the point I was just making. So if the US or Canada or UK or Europe is trying to, help in that sort of situation, you've got to have cultural competency, understand those local customs. And then you can have a conversation with them about how they need to adjust the practices so they can stay safe. Another lesson is about preparedness and prevention. So it's important to invest in a system that is resilient before the crisis comes, before it hits. Very important to invest. So that's about funding. That's about the budget and allocating, enough funds to healthcare. How about collaborative leadership? How does the local or the national or global actor, how do those different levels of actors coordinate their efforts? All right. And then capacity building, training the local staff to lead the response in a way that is sustainable. If you increase the capacity to deal with such a response, then you wouldn't always need that sort of external intervention to deal with it. So those are the lessons for leadership. So a leader will be thinking, right, I need to prepare my system before a crisis like this hits again. How do I get my people trained? How do I make sure that we can contain this sort of problem if it happens again? All right, those are the leadership lessons. Let's take the third example. This is something much closer to home. So this is the Ukraine conflict and health system disruption. I don't think there's anyone from Ukraine here on the call this morning. That's something that's still ongoing, really. Russia's invasion of Ukraine created a humanitarian crisis. We all know this. We hear it is in the news all the time. It has resulted in mass displacement and direct attacks on the health infrastructure. Can you imagine what Ukraine looks like? The entire infrastructure, the supply chain that is really funding or fueling the provision of healthcare services in Ukraine, completely disrupted. Again, people who were displaced have moved to other countries in Europe. That creates knock-on effects. on those contexts as well, because they need to be accommodated, they need to be looked after as well. So it's not just the physical health, it's also mental health. All right. So there's a lot going on with just that single political issue. Look at the effect on healthcare. So a leader is looking at information on the political terrain and looking at the implication for healthcare and then thinking ahead. How do I prepare? How do I make this system sort of shockproof, as it were? So leadership, I said to you at the beginning, is being able to synthesize information going on around you. Make sure you utilize that to get everyone around you to achieve a particular goal. So looking at what's happening in Ukraine, what are the key leadership challenges? How do you deliver healthcare in an active war zone? How? How do you do that? So much to think about. That's a very broad question. That's beyond management. That's leadership. How do you manage supply chain disruptions under a situation of a siege? How do you do that? How do you maintain continuity of care? So people who are going for cancer care, dialysis, even maternal health, women who are pregnant, going to have children, all sorts of things. How do you maintain continuity of care in that type of environment? That's beyond management. That's leadership. And how do you coordinate international humanitarian medical aid to help? So you can see stakeholder management is also involved in that leadership role. So what are the lessons here? Resilient leadership, resilient leadership. You must be able to adapt the delivery of care in an unstable environment. And some examples are mobile clinics. So you've got to move around to help people. You have to think on your feet as a leader. What can we do to solve this problem? Telehealth, using technology. All right. That's another way where there are, mass disruptions to the infrastructure, and there's a lot of inadequacy, funding healthcare workers. You can use technology. How about strategic planning? That's another lesson there to ensure that essential services are continued in emergency situations. You have to do some strategic planning around it. Ethical leadership is also another lesson point there. How do you balance resources that are scarce and care under pressure? Ethical care. How do you prioritize which groups you have to attend to first? And then advocacy. You need to mobilize support, lobby for protection. So there is that, global solidarity and advocacy role in terms of leadership. So you're dealing with the crisis within, you're dealing with stakeholders without. Okay. So these are different, and you can look at other contexts today. All sorts of things are going on currently, even in the Middle East. We've got the Palestine, we've got the Iranian one. Think about that. That's a political crisis, but it has implications for the healthcare system. And it's leadership that allows you to synthesize information from these different domains and translate that into action. What needs to be done? Once you have a structure in place, then management ensures that operationally everything is going according to plan. So it's the management that does the organizing, the staffing, the resourcing, the controlling, you're making sure that everything is working well and efficiency is achieved. Now, we've talked about practical situations. Let's talk a little bit about the literature because you're coming to a lecture. How has leadership been studied within the academic literature? So first of all, there was the attention to the traits of people, of leaders, all right? So scholars were interested in studying leaders and they were focusing on the traits. So they're tall, they speak well, think about some people who have the gift of the gab, it's called. They're able to hold people spellbound in their speech, or their, physical structure is intimidating, or they have charisma. But this is not enough. Just studying the traits alone is not enough to identify a leader. Some people don't have in fact, no one has all the traits. Does it then mean that they cannot lead because they're not tall, or they're not big, or they cannot speak well, or they're too introverted? So the trait approach is actually not enough. So some other scholars started looking again and said, right, if we want to move away from who leaders are, let's look at what leaders do. Let's focus on their behavior. And so they started studying leaders through time and focusing on what they did. And across these groups of scholars, was a very large group of scholars, they found that there was some main characteristics around what leaders did. Some people were more concerned about people, some leaders. Some leaders were more concerned about tasks. Some leaders were autocratic, some were more participative, some were democratic. So this was a focus on leadership in terms of what they did. But again, this was not enough to identify a leader because you're only looking at what is observable. There are other things around leadership. So another group of scholars emerged and decided, look, if studying who people are, the traits, physical traits, is not enough, and studying what they do is not enough, how about we study situations which create the need for a leader to emerge? Imagine yourself in a class setting, MSc classroom. You've been put into a group and you've been given a group task. You will be assessed on this task in 3 weeks' time. How does a leader emerge in that group? Eventually, something will push out the leader. So that's the example of a situational contingency. Sometimes there are things that create the need for someone to emerge as the leader, and then we can start to focus on what they do or who they are. They're able to speak well, able to inspire people, they have charisma. But first, it's the situation. So you see, through time, you had scholars focusing on different things just to try and understand leadership. And within this, this type of situation, there are other things that influence, how successful or effective a leader would be. The position of the person, the task, and the degree of structure to the task. If a task is largely unstructured, it requires a particular kind of leadership style. If a task is structured, it requires a particular type of leadership style because then people know what they're supposed to do exactly. And then the leader-member relations. If it's positive, then it requires a particular style. If it's not positive, it requires a particular style. So that's what sort of the situational, this is like the it depends on type of answer to leadership. All right. But still, there were other scholars who were focusing on several factors that involve successful leadership. Some of them emphasize the importance of the follower maturity. So far, we've only focused on the leader, but these scholars were saying, hey, if the follower is not mature, so follower maturity here means the ability and the willingness to carry out the task. That's the follower. So think about your team. If you have a leader who is good, but the followers don't have the ability to carry out the task, there's a problem. They wouldn't be able to do it, right? And your job as a leader wouldn't have, been done. If they have the ability to do it, but they are unwilling to do it. Have you worked with people like that before? They can do it, but they're just not willing to. You have another type of problem. What do you need to do with people like that? It's not the stick approach, it's to motivate them. It's to motivate them. And on this module in particular, we will talk about motivation. So, and other modules too. So again, we see through time, different scholars just focusing on helping us to understand what leadership is and what the factors that influence effective leadership are. And these are mainstream approaches. So the last group of scholars focused on sort of critical approaches to leadership. So they are not focusing on the leader or the follower. They have a more fluid notion of leadership. They see leadership as a process, leadership as a practice. Again, a lot more attention on the follower, emphasizing what the follower can do. So it's a much more fluid notion, and we will unpack it. We don't have time today, but just to give you a sense of what has happened in the literature, you've got the mainstream approaches to leadership that focuses on the traits, the behavior, situational contingencies around the emergence of a leader. You've got multiple factors and the emphasis on the follower maturity. And again, you've got the critical approaches to leadership, which help you to look at things like voice, access, all those other things, people competing interests within an organization. Whenever you talk about critical approaches, those are the issues that are at play. Okay, so that just gives you an idea of what's been going on in the academic literature. And so what do we get from all of this? Leadership operates within different contexts. So there is first the organizational context. Then there is the health system context, because we're talking about the health system, right? And then there's the global context. I mean, those three examples I gave you, Ebola, COVID, and the Ukraine crisis, you can see all of that nested. The organization within a health system, within a global healthcare context. And the person who can actively and appropriately engage with these layers context is the leader. Remember, our understanding of the leader cuts across who leaders are, what leaders know, and what leaders do from the literature. I sort of put that together to help you, use that in analyzing a situation. Who you are talks about your values. What are the things that drive you? As a leader, that has an impact on how you treat people, how you communicate with people. It's coming from your values, coming from your experience. What do you know? What training do you have? What's your background? There's a meeting point for all of this. And then that should naturally translate into what you do as a leader. As a doctor, who are you? First and foremost, who are you? How do you relate with others? It's coming from that place. That really centers you. Then what do you know and what you do? All of that aligns. This is another view of it, the leadership context. I've just talked about leaders' values, your identity, your personal identity, your professional identity, and even who you aspire to be. There are things about around emotional intelligence. Are you able to hold your fire in a crisis situation and allow people to speak before you respond? Or are you the type that needs to get it out immediately? Right? On the leadership module, we have a particular topic around leading the self. And it has to do with understanding your strengths and weaknesses. There are some aspects of yourself that you may not know. There is a framework called the Johari window. It tells you the aspects of yourself that you know and others know, aspects that you don't know but others know. How do you get them to tell you? If you don't create an environment that allows them to speak, you will never know because they won't tell you. There are aspects of yourself that you know but others don't know. For instance, you genuinely care about people. You're not that hard taskmaster, so to speak, or you really enjoy when people celebrate and come to, there's something about you that others don't know. How do you let them know? Communicate it. You have to let them know. Tell them. Tell them. If you see your staff doing something really well or your team members doing something well, don't be quiet. Tell them, look, I really appreciate that you stayed behind for an extra hour last week, Friday, so that we could meet the deadline. Thank you so much. You made a great difference. Tell them. Tell them. If you see something, say something. That's what makes you a different type of leader. So emotional intelligence, knowing the self, all of this is the internal context for leadership. And then you have the relational context, which focuses on, as we said before, follower maturity. If you followers or team members don't have the ability to do something, you know what that tells you? I need to find an appropriate training program for them so that they will be able to carry out the work. Okay, and check if they're learning, get them to feedback on it, get them to share the knowledge with the team so that you create a learning organization. It's not just around one person. That's concentration risk. If that person leaves the organization for any reason, the family may decide to relocate to a different country, the knowledge is gone and the organization has to start again from ground zero. So as a leader, strategically, you're thinking, I'm training this person, but I need to make sure that we've got a backup. Or find a way to codify what that person knows. If they're really good at their job, find a way to codify it, keep it somewhere, store the knowledge so it's available for everybody else. All right? That's knowledge management. That's how the leader also thinks. So it's about your leadership style. Is it participatory? Is it autocratic? Is it democratic? Which situations require more of a democratic style? Which require more of a directive style? Then understanding team roles and dynamics. This is still the relational context. When you put a team together, sometimes at the beginning, it goes through a storming stage, right? People don't know each other. They don't understand yet. They've come from different parts of the world, as we have in many healthcare organizations today, different functional areas, but also different ethnic backgrounds, different cultural backgrounds, different values, and different ways of valuing. You put all these people together in a team, how do you get them to work in one direction, one goal, one purpose? When this team is going through that storming stage, what's your role as a leader? How do you get them to just navigate that? Eventually things will settle and everybody kind of understands and they kind of get to some kind of norms. And that's the norming stage. And then they start to perform. So there is that dynamic when it comes to team development. How do you help them as a leader to navigate that? I'm not saying micromanage. No, they do their job, but you just get them to do that. You need to have communication skills. You need to have good negotiation skills because there will be conflict. When there's conflict, what do? Do you just turn the other way? There are some people who are conflict averse. They'd rather not be around conflict. Are you that type of person? Yeah, we all like to have a nice, peaceful environment, but sometimes conflict arises because of differences in opinion. I told you, people are not robots or zombies. They come to organizations with something. They're not coming empty. They may come with open minds, but they're coming with something. And sometimes you have those clashes. So as a leader, can you see that ahead, see far ahead, and prepare for it? Then you have the organizational context. What processes do you have in the organization? What kind of structure do you have? Is it flat relatively, or you've got a steep hierarchy where the CEO or the MD is at the top? You have several layers in between before it gets to the little employee at the bottom. What's the implication of that for hearing back from the team? Who are the key actors? What's the culture in your organization? What are the strategic goals? How about resources? Do we have enough? With healthcare, what is it like on the funding side? What's it like on the technology side? What's the implication of introducing technology on people? You have to think ahead as the leader. Would people feel that the jobs are going? We're talking about AI these days. You are the leader. Think ahead. You have to see far ahead. Wherever you are, remember, what does AI mean for my team? What does the introduction of this new, business improvement or this business process improvement, what does it mean for my team? Do they feel as if they're no longer valued? Are some of their competencies being replaced by machines? Think about the effect on people. Very, very important. And finally, the health system context is made up of several stakeholder groups, right? There's a political dimension, there's a regulatory dimension. I told you about it before. Take all that information. What does this imply? How can we position so that the delivery of care is continued? That's what a leader does. Are you getting it? That's what a leader does. So this is a nice, little view that helps you to see right the internal context, the relational context, the organizational context, and the wider national or global health system context. A leader operates in this environment, and many times that environment is volatile. Things change. You hear something happening in Canada, it's already affecting another part of the world, right? It just takes one person who has a virus to go into a New York airport, and within a matter of hours or days, you start to hear the spread of the virus. What does that mean? Okay, so think about that. Now, let's have the final exercise. I know we can't stay here for the whole day. It's a very short lecture. I want you to think about what you've heard today. What will you start to do different even now? From having attended this lecture, what will you start to do differently? I know some of you don't have leadership experience. That's okay. But I've given you a glimpse into the world of the leader. It's a difficult world. As I said to you, there's a lot of volatility, there's a lot of uncertainty, there's a lot of complexity, there's a lot of ambiguity. Things are not always clear. But that's when the leader emerges. And once you have the skills, you can face any situation like that with confidence. And that is what we do at the Global Business School for Health. We equip you with the skills to give you confidence to face that type of world, that type of healthcare, global healthcare ecosystem, and provide innovative solutions. So I want you to scan this code again, and I'm going to go back out so that we see the answers on the Menti. Can you tell me what one thing, just one thing that you will start to do differently? What is one thing you will start to do differently in your practice? And we're all going to see the screen now, so we'll see what everybody's sharing. Now, knowing what you know about leadership, we've talked about the Ebola crisis, we talked about COVID, and the huge, huge lessons for leadership. We've talked about the Russia-Ukraine crisis. We've looked at the theoretical perspectives to leadership. Just tell me one thing you can start to do differently in your practice. If you're not a leader or you don't have experience of leading a team, now you know what you can aspire to be. who you can aspire to be or aim for. If you've been leading people, what can you change about your leadership style? All right. So I'm waiting to see. I know this, is a reflection. So we encourage you to reflect also at the Global Business School for Health. It's a very good part of leadership practice to have those quiet moments for you to think, I want to be a better person. I'm a role model, but you need some time to also look inward. So what one thing will you start to do differently? Just share one thing. We're waiting. Lauren and I are waiting to read. Mention one thing you will start to do differently. Thank you. The very first answer has come through. Be as positive as possible, approaching things with a smile and belief and optimism. That is excellent. Do you know why? People are looking at you, they're watching you. Your team feeds off your energy. If you recognize that, you will go into that team environment with positivity, with a smile. Even if they're having a bad day, they know when my team lead comes around, everything is going to be better. They will encourage me. We'll face it together, even though the challenge is there. Optimism. Yes, there will always be challenges, and you won't always have the solution. It's about humility as well. When you are authentic as a leader, the team knows you can be vulnerable with them and tell them, do you know what? I don't have the answer to this, but let me have a look. I'll come back to you. Doesn't take anything away from you, but that optimism is really, really good. So if you're the one who is so focused on tasks, you don't even look up and talk to other people, this is a good sort of example to follow. Be positive, approach things with positivity, approach things with a smile and a belief, optimism, that positive belief. Thank you very much, whoever shared this one. Thank you. We're still waiting to hear from the rest of you. Knowing what you know now about leadership, what one thing would you do? Thank you. The second answer is through. I will encourage different perspectives in problem solving and not try to solve everything on my own. Thank you. Whoever sent this in, thank you for being open and being authentic. That's also what leadership is about. I won't try to do everything on my own. It's not about you doing everything. Remember Yoko's definition? Influencing others for positive change. And no matter where you are in the organization, it's just identifying where the solution lies. Sometimes it's you bringing supply and demand together. Oh, I recognize there's a need here, but I also recognize actually in the previous conversation, there's a solution there. Let me facilitate them coming together. And it's done. So it's not always you trying to do everything on your own as a leader. I know sometimes we are tempted to do this. We think, oh, I will do this much more quickly. I'll be much faster with this if I had done it on my own. But then you're not growing. You're not getting to that leadership position. But when you inspire people, you make them want to do it. They will, they will put in every effort and get it done. And when people trust you as a leader, they'll go to the ends of the earth for you. They will. That extra productivity you're looking for, you will find it because they believe you, they trust you. Thank you. We've got a third answer. I will start focusing on inspiring and motivating those around me. That is good. And you can do it. That's within your realm of control, of influence. You can do that. How do you inspire someone? You know what that means to inspire someone? You make them think, I want to be like her. I want to be like him. It means you have to be the change that you want to see. You have to start by being that change. And then they have someone to look up to. Okay, right. I'm going to stop here. Please keep your reflections coming through. It's fine, still afterwards. But I'm going to stop here now and hand over to Lauren, just in case you have any questions. Let me stop sharing. Thank you, Lauren.
Thank you
Over to
so
you.
much, Yemisi. Thank you. Would you be able to share those final two slides for me just whilst I
Oh, yes, I
pop
will.
in those links? So thank you everybody for joining us today. We do have a couple of minutes for questions. If you did have a question, please type it into the Q&A box at the bottom of the screen. I'm just going to run through a couple of key dates Most people on the call today will probably have an offer already, but we do have some joining who are prospective students. So if you're looking to apply for this coming September, applications close if you require a visa on the 27th of June, so not very far away now at all. And if you don't require a visa on the 29th of August. If you do have your offer, you've got 5 weeks from that offer to accept it. And our scholarship application deadline is also on the 29th of June. So again, 10 days away. I'm going to post in the chat now just the links to our scholarships page. We do have a selection of Global Business School for Health specific scholarships that we would encourage you to apply for, and particularly the Global Healthcare Leaders and the Women Healthcare Leaders for our master's courses. Are popular. So please have a look and do apply. If you could just pop on to the next slide, please. Thank you. And just finally, to keep in touch with us. So if you would like to book a 15-minute one-to-one appointment with Yemisi or even with one of our other route leads, if you're still at the start of your journey, then we have an opportunity to do so. The QR code's on the screen now, but again, I will just share the link in the chat. And that's an opportunity for, a one-to-one online appointment, just to have a chat, get your questions answered. And to keep in touch, please follow us on our social media, particularly on LinkedIn. There's so much going on in the Global Business School for Health. We're launching new scholarships, we're launching new programs, everything's always happening. And the first place to find it would be on LinkedIn. So we'd encourage you to follow. And we're also on Instagram and X as well. We've just
Oh,
got a couple more
is that all?
minutes. If anybody has a question, please type it in. We'll
Okay.
stick around for maybe a couple minutes and then we'll end our webinar for today.
Do you want to stop sharing now or
Yes,
keep it
that's
there?
fine. Yeah, either or.
Okay. Okay,
The links
that's
are
fine.
in the chat if
Yeah.
needed. I'm also just going to put in our contact email address. So if you do think of a question after today's webinar is finished or anything to do with admissions, any question at all, if you email contact@gbsh@ucl.ac.uk, we can put you in touch with the right person. Oh, we've got a question. I will read it aloud.
Okay.
I've got an
Okay.
unconditional offer and external scholarship, but won't be able to provide a deposit end of this month due to the scholarship legislation. Contacted UCL but haven't heard back yet. I'm an international student. Okay, that is quite a specific question. I'm actually going to reply to that with our specific admissions email address because I
Okay.
think that is something for our admissions team. Whilst I do that, there's just another question that's just come in.
All right.
Could you share a specific example, either from the group business project or your own faculty research, where students have applied the leadership competencies to solve a real-world global health challenge, and how UCL integrates interdisciplinary and industry stakeholder input into that process?
Oh, wow. That's a complex question. Right. So the Business School for Health is interdisciplinary in terms of its faculty and staff, in terms of the students, but also the way that we teach. And that is already baked into the curriculum. As I said before, um, the kind of case studies that you would even be working on in seminars are taken from different parts of the world to give you that global view. And our faculty also do research-led teaching. So it will come through whether they're teaching finance courses or organizational behavior or human resource management or leadership, all of that comes in. So for example, my research on culture comes into what I teach on leadership and management. You talked about business projects. The business project, there are several groups, over 400 and 500 students take the business project, and they're made up of people from different disciplinary backgrounds. So it's not just students from the global healthcare management leadership route put together in a group of 5 on the project. You're dealing with people from finance, from the digital health, biotech and pharma, and everyone comes, looks at problems through that lens, and they're able to contribute meaningfully to the project. So the finance person helps with the numbers, the accounting, the cash flow projection, particularly for the business project, that sort of thing. The person who is on the leadership roles perhaps could help with more strategic decision making or structuring. The person around biotech and pharma could help with specifics around the pharmaceutical industry in terms of the context of the problem. Maybe the digital health and entrepreneurship person would look at the technology that they're trying to bring to market, and then they talk about, all the other things. It's really a very, very interesting piece of work. So again, you see interdisciplinarity embedded in the program in different areas. So not just the group project, but the faculty that we have, the way that we teach, the curriculum itself, and the cases that we bring and examples that we bring in the class. It's all embedded. And of course, it's focusing on a challenge, isn't it? The business project is focusing on meeting a need. Create what's your solution to a particular need you've uncovered? What's the challenge you've seen, and what's your solution to it, and how do you do that, and in a way that you actually move it from ideation to the original project. And we actually have some students who have taken their projects, they've gotten some funding, some seed funding, taking their projects forward and set up entrepreneurship businesses to really run that. If you check on our website, you see there's an example of a lady who develops an app for women who are prone to postnatal depression and things like that. So we do have that. So when you come in, please do take it seriously. You just never know where that next business idea would land you or what it would bring. I hope that answers the question. That was a long one.
I think we've got time for just one more question. So I'll ask this one. Do you think it's worth having some experience in clinical care, like seeing how leadership works in UK health systems? And would this be good to add to the personal statement?
Okay, if you have the experience, put it in your personal statement. If you don't have the experience, you don't need to say that you do. We want to see authenticity in your personal statement. As I said to you, we're not looking for clones in the classroom. We want that diversity of backgrounds, of disciplinary backgrounds. So if you have relevant experience, that's fine to put in there. Like the doctors already have relevant experience. If your experience is in human resource management, but in a healthcare organization, that sort of thing, that can be, you can argue that that is relevant because this is what you were looking after. If your experience is, in other areas, you can mention that, but make the links to what you want to do. So it's really about why is this program, why am I applying to this program? Who do I want to be? So take some time to think about that. Who am I? What's my background? What do I have? Where do I want to go? And how does this program help me to get there? That needs to come through in your personal statement. That's what we're looking for. Have you got it? Who am I? Where do I want to get to? Why? How does this program help me get there? Okay. And all the best with your application.
Okay, perfect. Well, we're out of time. So I'd just like to say thank you so much, Yemisi, for your lecture today.
Been a
And thank you
pleasure.
to our attendees for joining. Yeah, please do have a look at those links. If you have any further questions, please email. And we look forward to seeing you very soon.
Yes,
All right.
indeed. Yes, indeed. All the best, everyone. Thank you so much for being here. Bye bye.
Bye bye. Thank you.